Hey everybody, welcome to Aging Intelligence. Today we're going to talk about a couple of really interesting things with Halle. We get to why is the healthcare system incented the way it is and what can we do about that? We talk about how do we find the best care workers for older adults and how do we motivate those people to provide better care and stay in this job that is so, so important. If you're liking our podcast, please subscribe in Spotify or Apple or on YouTube, wherever you get your podcasts, and also rate us 5 stars because it helps other people find this content about how society's leaders are helping us on our aging journey. With that, I really hope you enjoyed today's conversation between myself and Halle Tecco. Halle, I first met, I think, right when we were starting Honor because Halle founded Rock Health, and Rock Health was actually one of the first investors into Honor. And she has dedicated her career to making healthcare massively better. So she, like I said, founded Rock Health. She's been investing in healthcare-oriented startups, and I'm sure other startups for a very long time, has advised multiple of them, is on multiple boards. She teaches about the future of healthcare at Columbia Business School and Harvard Medical School and serves on the boards of Collective Health and Cofertility. She has a new book. I think she's on a book tour about that right now, Massively Better Healthcare, where she distills 15 years of lessons into a guide for leaders who want to leave the system better than they found it. There you go.
This is my bedazzled copy of the book.
That's awesome. That is a very good copy of the book.
Yes, limited edition.
Where are you? You're on your book tour right now? Is that right, Halle?
Friday was technically my last in-person event, and now I'm just doing some virtual stuff. So it has been several months, and it's been so much fun, but also very exhausting.
I'll bet it has. I'll bet you're ready to go home.
Yes.
Sounds good. Well, thank you so much for coming on. Really appreciate it. You are a default expert in healthcare. So I think we should just start on the kind of healthcare topic generally, and then we can kind of get into the implications for older adults. So this is going to be a broad, maybe unfair question to start with, but what is the state of healthcare today? And I know that's super broad, but particularly in America, right? Where do you see healthcare? What's working? What's not working? Where are we?
Yeah. Okay. Big question.
Big question.
Let's just say we're at a breaking point, right? Our costs have spiraled out of control for most Americans. And we are at this point where it is finally on everyone's mind, and it's breaking all of us, that we're starting to see these cracks really open. And in some ways, it's a good thing because we're having conversations about things like pharmacy benefits managers that the average person didn't really know about. And now we're starting to really understand it. We're also seeing people that are suing their employers for breaching their fiduciary duty of managing their health benefits. And having that level of sophistication where they understand that their healthcare dollars are being poorly spent by their employers and taking action. And that's something we had never seen before. And just in the last couple of years, have had a couple of examples. It is very much becoming something that is political, and we're seeing healthcare on the ballot in many ways. And I think the biggest piece of this, and really a lot of it relates to your work, is the fact that we have a sick care system. And while we do have a safety net, the safety net is really downstream, and it really is only helping people after these problems have arisen. And actually, even just stepping back from that, our current healthcare system was built a century ago to treat acute infections like the flu or pneumonia that needed that reactive inpatient care. But today, 8 of the 10 leading causes of death are chronic diseases. These are things that develop slowly over decades and can be largely prevented. And so we have this system that waits for people to kind of fall into crisis before intervening. And so a lot of the work I do is advocating using new business models and technology to move that safety net upstream. This means engaging patients earlier. This means investing in primary care and public health. This means shifting from hospital-centric care to hospital at home, community-based models, a lot of things that you're doing. And so what's exciting of where we are now in healthcare is that innovation and technology is finally making it possible to deliver this care in new ways at lower costs, with better outcomes, and better leverage the healthcare workforce that we do have so that they can do more and deliver better outcomes for patients. So Yeah, go ahead.
I'm like super curious about this concept of kind of preventative care versus, oh, you're sick. Now I'm going to
Yeah.
go try to help you. So I have always understood the argument in the employer funded world, which, as I understand it, goes something like the average person who's, in United right now because their employer, uses United. United is not incented. Their employer is not incented to do preventative care because they're going to go have another job. They're going to be covered by someone else in 2 years. So therefore, we're not going to try to figure out if they're going to get cancer.
Yeah.
Right. That's the argument I understand. Now, what's interesting is then someone hits 65. They end up in Medicare land. And you would think Medicare, since it now is responsible for that person for the remainder of their life, it would want to do naturally preventative. And you would think that might be true in Medicare Advantage. So can you break that down for us? Is that actually, is it true? Is it actually happening?
Yeah, no, you hit the nail on the head. And I've heard it said that like health plans are just really kicking the can to Medicare and just kind of pushing things off until there is that public option. I mean, the fact is, as you said, like annual enrollment, we enroll in our health plans in 12-month increments. And so the insurance companies are thinking about ROI in 12-month increments. There's very little financial incentive for an insurer to invest in any sort of lifestyle intervention today if the ROI, like a stroke that's prevented, accrues to a different payer in 5 years. And the same thing for employers that are self-insured. The average tenure of an employee now is under 4 years. So even if you were to think, okay, maybe they don't have the 12-month increment, they have a 4-year increment, that's still not enough time to really make these like long-term investments. And so we're trying to build long-term health solutions on top of these short-term, payment logic systems. And so in a lot of ways, we're stuck. And this is a thing that has been frustrating to a lot of innovators because it's like, this is what we need to do. We know what we need to do, but we are sitting on top of a financial system that is simply too short of a time frame. One of the ideas I've heard actually from Scott Galloway, who's not even in healthcare at all, but I love this idea. He believes in a Medicare for all who want it eventually, which is becoming a more popular idea. But his idea is like, hey, why not every year we lower the Medicare eligibility rate by 2 years? Because putting everybody on a public plan overnight would just be a very challenging feat.
Lots of things would break.
But yeah, lots of things would break. But if we kind of slowly grow that as an option and think about building an earlier catch-all, that's optional. You can still do your private insurance if you prefer, but having that as an option for people who do want it, knowing that you go into it and hopefully the Medicare does have those incentives to invest in things for your whole life.
Yeah. That's interesting. So, on this topic of kind of that really interesting idea, kind of, Medicare going down in age. And when we're talking about Medicare, what we're really talking about is single payer government funded. And lots of other countries around the world have that. And I'm kind of curious from your perspective, and we're going to actually bring this to older adults in a second, but where do you think the U.S. healthcare system sits versus kind of rest of world? And I guess I would say particularly rest of kind of world that looks like America, like continental Europe, United Kingdom. Like, would you prefer be a average citizen from a healthcare perspective in those countries or America for real? And actually, let's say that you just turned 65. Let's say you're 75.
Yeah.
Would you prefer being in America or would you prefer being in one of those countries with the realities of healthcare today?
Such a great question. I recently gave a talk to a healthcare company based in Canada, and they were, complaining about access and time to see a specialist. And I said, I hear you. Those are real problems that you face. I don't want to diminish your lived experience in the Canadian healthcare system, but just so you know, per capita, Canadians pay half what Americans pay, yet you have a lifespan that is 3 years longer. So like, in the minute details, you might be unhappy with your healthcare system, but when you step back and actually look at what you're paying and the value of your healthcare, you have a better system than we do. And in the US, we essentially have two systems, right? We have, if you are in the top 1% of Americans and you can pay to have access, you have access to cutting edge therapies, to specialists wherever you need them, concierge medicine. I mean, you are set. But majority of Americans, healthcare is the number one reason for bankruptcy. Most Americans don't have access. 100 million Americans don't have a primary care physician. So the disparities are just so great that like, you and I could be fine in our healthcare system. So I would say like the US healthcare system, does it work for me? Yes. But is it working for other people around me, including loved ones and family members? No. And that's an injustice that I just cannot stand for.
Yeah. So, you've raised this really interesting topic about concierge medicine and where healthcare is. So my father is 76. And, I saw him, he came to visit me, and just like, I could just tell everything was kind of going wrong on the healthcare side for him. And he lives in Ithaca, New York. And it's complicated. It's hard to access. And what I did is, because I can, and it's unfair, is I was like, Dad, I'm going to literally sign you up for a concierge doctor. And this person is going to work with you to get you on a better trajectory, because I could just see that the trajectory was really bad. Yeah. And, in a year, the trajectory really did change.
Wow.
But it's because he had this person who was there really working with him on, okay, there are all these things that have kind of been trending in the wrong way, and it's just really complicated. Access in Ithaca, New York isn't actually so great. So we're going to do the things to get you on the right track.
Yeah. Yeah. I mean, that's too bad. I'm glad to hear that he was able to have that resource. But when I think about concierge medicine or direct primary care, it serves those who have access to it, but it actually only furthers the clinician shortage we have, because they're able to have smaller patient populations than a clinician who has to see a general population. And so it only worsens our situation, which also is exacerbated by the fact that places like Ithaca and rural areas where immigrants are more likely to take up residencies and jobs in healthcare are not coming to the US anymore. Not just because of H-1B visas issues that we see, but also just like there's a general anti-immigrant sentiment that is really hurting healthcare. And I forget the exact stat. There was a JAMA article about what percentage of physicians are foreign born, but it was way higher than you would expect. We have for a long time depended on immigrants to staff healthcare, especially home health aides. And I'd be curious to hear from you, like what you're seeing there in terms of just like how harder it is to staff these areas that have largely been immigrants that have picked up the slack for Americans that won't go there.
Yeah. Yeah. No, and it's a real issue. So, it's interesting because like everybody is very concerned about AI taking people's jobs. And there's one area where AI just is not going to take jobs. In fact, it's going to create a lot of jobs, and it's going to create better jobs. And it actually is I think in healthcare broadly, but certainly home care for older adults. And when we look at who is in those jobs, there are lots and lots of, American-born people, but there are lots and lots of immigrants who are also in those jobs. And we are short care pros constantly. Like we are just always recruiting. We are always running top of funnel as much as we possibly can. And at any given time, we probably have 10,000 people plus, 20,000 people plus in our recruiting funnels, literally at any given time.
Wow.
And there are just not enough.
It's just not enough still.
And the thing is that in the next 20 years, we're going to triple the population over 80. And so, and we're out of senior care facility capacity. They operate at about 85% capacity. Only 10% of people over 80 live in them. So it's not like you can say, oh, well, it's okay because people can just go into these, facilities. Like, no, that's actually not.
There's not going to be any room. They'll be on a wait list until they're dead. Yeah.
Yeah. And then some people say, well, robots. And when you talk to the most advanced kind of roboticists, and you tell them the problems that they would need to do to work with an older adult, the most advanced roboticists even today say 30 years. And so, like the clamping, this particular area that I know the best on labor, like we have a absolute shortage, and we need immigration actually to ensure that we can care for older adults.
Yeah.
And I'm kind of curious on that.
Yeah.
And if we look at healthcare broadly, and kind of workforce issues in healthcare. Yeah. One big issue is clamping down on immigration, and it is both the policies, but also the sentiment, right, that you're talking about.
Yeah.
What are other kind of core workforce issues in healthcare that you have seen as you look at it broadly?
Yeah. On the clinician side, the AMA has long and look, the AMA is a supporter of a lot of great things and was just sponsoring the Rock Health CEO Summit last week. I think highly of them, but the fact is they've lobbied against policies that have been about upskilling physician assistants and nurse practitioners, and so there have been lobbying bodies that have prevented us from seeing these workforces able to kind of be upskilled and do more with their degrees and practice at the top of their license, as we say.
Yeah.
So I think that's an issue because we need to do more with less is essentially boiling it down to the basic first principles. We need to be able to do more with less because, as you said, the population is growing. The workforce shortages are only getting worse. But I'm still hopeful because I do think that we have a lot new opportunities that just did not exist when you and I were starting in this field 10, 15 years ago. I mean, technology that we have today is just so fundamentally different and so enabling. One of the things I do worry about in your space is the trust factor. And, I have an 80-year-old dad who doesn't even use Google Maps and GPS on his phone because he doesn't want to be tracked. I don't know. I'm like, what are you hiding from me? I don't know. But I find this generation to be much more concerned about trusting technology. And so, even when you think about the interesting innovations that we have now, like cameras that can alert someone if someone falls, I worry about the adoption amongst this population. And even, when did you say it's going to triple by? People over 80 is going to triple in how many years?
20 to 25 years.
20 years. So those are people who are, 60 now. I would say, 60, the 6-year-olds I know are also, a lot more skeptical than millennials and Gen Z. So that's one of the things I think that we really need to work on as innovators and people who are pushing technology is we need to make sure that we have to engender trust today so that we can actually see meaningful adoption.
Yeah. So the trust thing's super interesting. So we have some recent data on this because we've been looking really hard at devices to do monitoring in the home of older adults. And I've got this really interesting story from one of our businesses. And the person who runs that business said to me, we installed these devices in the home, and then we would go back to the home, and magically they had just somehow become unplugged.
Unplugged, yes.
And I think the issue there, it's actually really interesting because it comes from a place of I don't want to be spied on. But I think from my perspective, it also comes from a place of the value I perceive I'm getting is not greater than the cost to be spied on. And so I think there's actually an inherent product problem there, right? It's like, you're spying on me to what end? Thanks for telling me that, I'm sick or whatever it is. I need more than that in order to want this thing to actually monitor me.
Yeah, we need the product marketers to work on that because I agree, the value proposition and just explaining what exactly it is. Like if it's motion detection versus video, how long the video is saved. I mean, I do feel like there are nuances to it that could help it from being unplugged.
Totally. The healthcare system feels like it's one thing for the general population, and then maybe it's a different thing for older adults. And I think the stat is 65% of the utilization of healthcare actually comes from older adults. It's of that order of magnitude because obviously as you get older, you need more healthcare.
Yeah.
Have you looked into that at all? What are the core differences and experiences when you're an older adult accessing healthcare versus general population?
Yeah, I think that a lot of it is actually patient-driven because you are more likely to be engaged in your healthcare when you are managing chronic conditions, which you're more likely to have in your older age. And so, from anecdotally, the elderly people in my life, in my family, who are managing their healthcare, they have no choice but to be engaged because they have multiple medications that they're on. They have multiple specialists that they see. They all have, my mom had back surgery last week. My dad had cataract surgery a month ago. So I feel like the level of engagement is higher because they are they have no
Yeah.
choice but to manage
Forced
these
engagement, right?
yeah, exactly. When you're like 20 and invincible and
Right.
like, you have like a pain in your like abdomen, you kind of just are like, oh, let me see how I feel tomorrow. And like, you kind of punt in that you can be less engaged with your health and likely fine, unless of course you're living with a chronic illness. But I think there's something to be said about the need is greater and thus the involvement is greater. And then also they're retired. So they like, not my mom still works, but my dad is retired. And, they just have like the time to manage it. And I don't know if you've noticed this about our parents, people our parents' age. It's like they do like one thing a day and that's like their focus. They're like, you call them, you're like, what are you up to today? Today I go to the grocery store. What are you up to today? Like today's the day I go see my primary care physician. Like they have this like really, I don't know, lovely focus of like, that's my priority. And I'm going to like, that is my day. I'm not going to be bothered by other things today. And I find that they really like take it very seriously, at least that, and my parents do. So I think they're engaged. Now, that being said, one of the things I talk about in my book is this like matrix of sick to healthy, engaged to unengaged. And our healthcare system really focuses on the sick and engaged. Like we have our entire healthcare system built around it. And then we also have this like wellness industry that's popped up for like the healthy and engaged folks.
Yeah, good point.
We sell them a lot of pseudoscience because they want something. They're just dying for something to stay healthy. And we don't have a lot of preventive health interventions. And so they go and do peptides and whatever else they do. And so like one of the biggest opportunities that I see are for folks that are both healthy and unengaged so that we can embed them into preventive health sooner, get them a primary care physician sooner, as well as the unengaged and sick. And I tell the story in my book of my uncle who never had a physician and got to the point of being so ill and costing the healthcare system so much money at the end of his life versus, I mean, he was a smoker, he had cancer, he had what they call adult failure to thrive. Had he been engaged in healthcare, decades sooner, he wouldn't have cost our healthcare system so much money at the end, and he probably would have lived a lot longer than he was able to. And I think that like that engagement piece is one of the trickiest pieces because it's behavioral. But a lot of it is also access and also building a healthcare system that people want to use and people aren't intimidated by or feeling, people feel disenfranchised and feel like they don't belong in the doctor's office or that they're going to be judged for their lifestyle choices. There are a lot of reasons someone is not engaged in healthcare. And I think that there's a lot of work that we can do to meet them where they're at and help provide them care earlier in their journeys so that we can avoid just catastrophes down the line.
So this is interesting. So if you were to take that and kind of extend it into like the one innovation that you would love to see in the healthcare ecosystem for older adults in particular, like this is the thing that could truly make healthcare better for older adults. What do you think that would be?
I don't know if I have the answer to that. I feel like I'm not myself an innovator, right? I support the innovators. And
Okay,
like my book
can I
go ahead.
I'll give you one.
Yeah, give me one.
So you tell me, I was going to say, I know you're the investor, so maybe let's play our roles. I'll be the entrepreneur.
Yes.
Like, how important do you think it is to move the site of care to the home, especially for older adults? Like, how transformative do you think that could be?
Hugely. And I'm sure you have good data on it, on just access, convenience, comfort. So, it's something like the aging in place movement has had advocates behind it for so long. And it would be nice if we could match dollars and investment to that advocacy work, because I think we know that not everybody has access to get to a physical place. And we now have the technology to bring that care to the home. So we can lower costs, we can improve access. Yes, I mean, it's a no-brainer, but I would say, there's probably good data on it. Like people that do have access to at-home care, what are their outcomes versus someone who doesn't?
Yeah,
There's
totally. And then
gotta be good data on it.
On the topic of kind of innovation in healthcare in general, I'm sure you're looking at this. AI is like, everyone loves to talk about AI
Yeah.
these days. What do you think is real? Like, what is actually real in AI in healthcare, and what are the metrics or benefits that we should be looking for coming out of it?
Yeah. What is real is that 40 million people every day are using ChatGPT to look up healthcare information. And that is enormous for a tool that wasn't even around 5 years ago. And what I'm seeing is that a lot of the healthcare providers are upset at that. They don't want that to happen. And, they're focusing on like the negatives of people using AI for health information versus recognizing that this is the result of our paternalistic healthcare system that has withheld information and access for so long. And now people have access, or what they think is access, at their fingertips. And so I think instead of being worried about the action people are taking, what they need to be worried about and focused on is, are the results that they're getting accurate and safe? And that's the only conversation I want to hear with providers. Is like, how can we make sure these tools are accurate and safe? Accurate and safe. You're not going to stop people from using it. This is game changing for so many Americans who've had just been so cut off from healthcare information, how to manage their health, that it's just like inevitable. So that to me is very real. Like that, there's no going back on that. And actually, Rock Health just put out a report also on the usage. And it's like 1/3 of Americans have used, a AI tool to ask health questions. So it's, it is happening right in front of us. And to me, that feels very real. On the clinician side, it'll be interesting to see how this plays out, because most of the innovation and most of the funding has gone to the back end RCM, revenue cycle management, billing, administrative
efficiency
pieces.
stuff. It's like efficiency plays. Yeah.
Yeah. And I haven't seen a ton of reports or data around the ROI, but they're paying, big dollars for it. So presumably this has been beneficial. But where it gets really interesting is actually when it goes to delivery of care, right? We're also seeing a little bit of like the co-pilots for clinicians, obviously scribing, but scribing is built for billing. It's not necessarily built for anything else other than billing.
Good point. Yeah. It's crazy.
But when we'll actually see AI involved in the delivery care, and we're starting to see snippets of it, like in Utah, they're doing a pilot right now for AI prescribing for renewals of medications. So instead of having to see your doctor or talk to your doctor for a set number of prescriptions, they have this like chatbot that you can just get that renewed, and they're trying it out in a pilot in Utah, which is really interesting. You can think about all these other use cases that are like good places to start that seem to, that they're not real yet, in that it's still early, but you can see it being super helpful. And I just had a really great conversation with on my podcast. I haven't released it yet, but with the CEO of Baylor. And I know Mayo Clinic is doing this too, but like really investing in using AI for like patient-centered tools, whether that's like digital twins, so you can ask your quote unquote doctor questions that they can, they can help answer virtually, to things like a post-op call, where you get a call and it's actually an agent that's giving you reminders, asking questions, and then elevating anything that sounds urgent or needs flagged, that at least like we're doing calls that might not even exist today. And so that's what I'm seeing, like these hospital executives, where they're actually genuinely excited about this. And that is like so different from where we were in healthcare 15 years ago. Traditionally, hospitals have been laggards of technology adoption, and have been like, companies that would come pitch us that like we're selling to hospitals were like, they just, hospitals have already thin margins. They have, they don't have deep pockets. They weren't making these investments a decade ago. And now there was a Menlo Ventures report that was showing that hospitals and healthcare is adopting technology 2.2 times faster than the rest of the economy. And hospitals leading the way. Hospitals being faster than payers, being faster than pharma. So it's a really cool time to see this adoption of AI in healthcare. And that's where, where it's real right now is kind of in the boring back end stuff. But to me, it's like, these are like the first innings. Like, let's get comfortable. and use these tools in ways that no patient can be harmed, and it's actually hopefully helping providers just reduce the waste and inefficiencies. And then we get into the cool stuff, which is really more clinical.
Yeah, totally. Yeah, it's really interesting because I think AI like disproportionately works in a place like healthcare or, home care for older adults or whatever, because it is so good in a personalized setting, right? Like if you think about it, it's the technology that enables technology to meet people where they actually are based on who they are. And that's always been the problem for technology in healthcare. It's like it kind of wants to fit you into this very tight little box and treat you like a widget. And that doesn't work in senior care. It doesn't work in healthcare more broadly. So it's almost like this moment is massive for any industry that really touches and works with people, right? Because now you can transformatively change your service delivery.
Yeah. And we've been talking about personalized medicine for, my whole career. But have we had the technology to really deliver on it? No, we haven't. And now it's like within grasp, which is super cool.
Yeah. And, and I've actually been seeing the exact same thing, like amongst our owner set within our Home Instead franchise network. They are like so excited about AI technology now in a way that I've just never seen them excited about technology at this level before. And it's because of all this, like people feel it is possible to make a real change and make a real difference in what they're delivering, which is pretty cool.
Yeah. The other thing I really love about it is that it's becoming like you come from a software background. So like you're a tech person at heart, so it doesn't intimidate you. But for a lot of founders and innovators who do not know how to code, or like they're not, developer by background, getting an idea and like just being able to vibe code it and just be able to like in plain English explain what you want to do, it's really empowering folks who previously wouldn't be able to. Maybe the farthest they could get is being like a product manager. Now they can just like test out in real time different tools, and I think that's great. And it means that it's just lowering the barriers for starting a company, for like building out new tools, and so hopefully we'll just get like more ideas out there and tested than ever before, because we don't have the bottleneck of a $500,000 a year developer that you have to hire in order to get something built.
To build anything. So I'm actually curious, as an investor, how you're dealing with this. So one of the things that we're grappling with as a company is there's like this crazy explosion in vendors who are pitching us at HQ or franchise owners out in the field. And they're like, I have the greatest whiz bang thing ever. And, it's like you ask them, how many people do you have in your company? It's like 2.
Yeah.
How much funding do you have? None.
Yeah.
How long did it take you to build that product? 2 weeks. And it's like, it sounds really cool. And I'm sure it might work at low scale, but man, like it's become almost so easy for anyone to create a thing that we now are getting a bajillion pitches in a way we never have before.
So crazy.
Can I work with you? And I'm sure as an investor, you're getting like a bajillion, will you fund me at a level you've never had before, I assume.
Yeah.
Like, how are you thinking about what's real and what's kind of
Yeah, I mean, what a great question. And I've heard that also from, on the provider side, getting, just more inundated with pitches than ever before. But I think like in that case, it's like, this is why SaaS stocks are down, right? Like there's a sense of like, okay, you could build it that fast. So could we.
So could
and
anyone.
So like the need for like these external vendors is like, negligible now, because you're like, can we just build it? And I think that's what's happening in the market. And we're seeing that reflected in the market. Like Seth, the world is coming to us with like tech-enabled healthcare delivery backed by real humans. Like that has been something that I have invested in my entire career. It is something that I don't think humans cannot be replaced in so many of these jobs. And so to me, like the value there is going to be building that network, closing those deals, building out your platforms, and things that could just be like, I see so many things where I'm like, it's like the ChatGPT for healthcare. And I'm like, that's just ChatGPT.
Right. It's literally ChatGPT with a different brand on it.
Yeah.
Like, good job. Yeah.
I don't, like, and it literally is though, right? Like they literally are just using the ChatGPT API and calling it ChatGPT Healthcare. And so, I agree. Like there are a lot of things that will, not make it because of that. And I'm seeing a lot of that. But I think like the value now of any, delivery backed, like human led platform is that much more valuable because all these just solo AI tools are easily replicated.
Yeah. It's funny. I was literally just on a call with an entrepreneur, one of these entrepreneurs who's pitching us.
Yeah.
And she's super high energy. She's obviously clearly super smart, good early traction. And she was telling me about the tool she had built. And I was like, the thing you have to understand is 10 other people have literally built at minimum this exact same tool.
Yeah.
So the question for you is, what makes you different from the 10 other people who've built the same tool? And the answer is like, can she somehow get better distribution or somehow get a better data set? But I was also at an investor conference last week. And basically what we were saying is, look, like value now is either network effect or proprietary data. And proprietary data actually gets fed by something that has network effect, right? And like, if you don't have one of those two things, it's hard to imagine where enduring value comes from, because just a software thing, like, our CTO for our UK business was showing me an applicant tracking system that he coded up in 3 weeks using Cloud Code, right?
It's so awesome.
It's crazy.
Yeah.
Yeah.
And we're seeing, so I'm on the board of Cofertility, and we are, we're an egg sharing platform. So young women can freeze their eggs for free when they donate half of them to a family that can otherwise conceive. So we have a big group of like clinical operations specialists. We call them member advocates, and they're the ones that are helping both the families, the recipients of the eggs, as well as the egg donors, kind of go through the process, right? So it's like a very like concierge-like experience for them. And what we did was we just had like a hackathon for them where we taught them how to use these tools, how to use Claude Code. And we did this hackathon and they literally came up with the best ideas that were like better than what our product and tech team could do, because they are so intimately involved in their jobs that they know what can and should be automated and what shouldn't. And I think that that's so, like, I just love that we were able to do that. And I'm now like encouraging other companies, like make sure that your employees have time and space to learn how to use these tools, because first off, like, great professional development for them. Like, they're gonna like just enjoy their work because you're investing in them staying like relevant in their skills. But they also like have such great ideas. They're so close to the problem that they're going to be some of the best people to come up with these. So like, it really is exciting. And I think healthcare, people who work on the human side of healthcare, who are actually delivering care and value to people, like they choose to work in these, like, they're like, emotionally, these are very hard jobs. The sort of toll it takes. And actually when I studied for my public health degree, one of the classes I took was on occupational health, and just like the burden of being a healthcare worker, and how we've done the opposite. We have not supported these folks in these roles at all. We just tell them like, it's like we give them instead, like, you should have like this God complex. You can do anything, versus like recognizing that they're human and that these are very hard jobs. But I think that by now enabling them to free up, and you change your job, you are not going to be replaced by AI. You will be replaced by someone who uses AI in a way that makes their job more efficient. And so empowering them to make their job, like, this is in service of you. Like, let's take the parts of your job that should be automated, that are tedious, that are boring, that are hard, and like you take the lead in making it better. And it's so empowering, and it's been so successful for us at Cofertility. And I've been sharing this with a lot of founders that I'm talking to, because it's like, don't leave the code vibe coding just to your tech team. Like, let everyone in on it.
A number of my friends are doing, I'm going to steal this because we're about to do it too. They're basically doing whole company 1 week pauses. Cool. Where they're putting their entire roadmap on pause for a week.
Yeah.
They're having a small tiger team kind of get everyone in the company enabled with the right tools and platforms.
Yeah.
They pause for a week and they basically say, in this week, we are going to set everybody up on the right platform. We're actually going to give everybody like groups. We put everybody in the groups. We're going to give everybody a project. And at the end of the week, like, everybody's going to have a project. So it's like forcing people to learn the new platform and do something with the new platform, because there's a recognition that like, we literally need to train everybody, be it not just engineers, but people in marketing or people in communications or people in legal, HR. Like, hey, it's a whole new world. We can all work differently.
Yeah.
And then to your point, it's actually really interesting. obviously honor exists and home instead exists in this world where it's human services.
Mm-hmm.
And, like you were saying, and the way we think about that is the human services org that is AI enabled as much as possible, where you make those humans superhumans.
Uh-huh.
Those are going to be the ones that deliver the best experience to a customer. But like at the end of the day, a patient or an older adult or their kids in our case, they just want an amazing human. You got to give them an amazing human because that's like the service. Like we were saying, we're 30 years away from robots.
Yeah.
Maybe. But if you can make that human AI enabled where they know you better, they understand your preferences better, they know what you're going to want for breakfast, they can anticipate what you want, right?
Yeah.
They know more about you before they walk into the home. This is where you can really differentiate and use AI to actually create a fundamentally better human interaction.
Yeah, totally. So what tools are you guys using?
So we actually build the dramatic majority of stuff in-house. So our engineering team, an example would be, let's build an AI that looks at forward visits. Like, this care pro is supposed to go to this client in 3 days. What is the probability that the care pro is actually going to go? And then that AI might become concerned. It might say, you know what, I'm worried that there's a risk this care pro is not going to go. And it'll trigger another AI algorithm that'll ping the care pro and have a conversation with them and say, hey, are you actually going to go? And if the care pro ends up saying no, then the AI will then kick it to a different AI system that will say, hey, I have to find a new, care pro to fulfill this visit now. So that would be one example.
Interesting.
Another
I'm sorry, is that
really-
being used? Sorry, like asking you questions. So this is like my nature of being the host.
Like, no, go
is
for
that
it.
using historical data on their attendance, or is it using like their distance from the client, and like what sort of data would you be able to?
So you actually, great question. So we used machine learning which is basically, kind of the data set, let's call it the data sciencey version of AI, to figure out what the top predictors are of someone who wouldn't go. And so it's stuff like distance. It's what was your schedule like? It's when did you get that assignment? It's how good a match are you with that home? There's actually probably 20 or 30 variables that go into what's the probability that you're going to go. And then you can assign it kind of a real-time risk score.
Yeah.
And if the real-time risk score gets too high, then it triggers and takes an action, because you don't want to ping every one of your care pros and say, are you going to go? That's
you don't want to be annoying and like,
offensive.
what, do you not trust me?
Yeah. It's annoying. It's offensive. It's bad.
Yeah.
Another really interesting use case for AI, again, one that we very much built ourselves, is how do you give a care pro the job that they really want? So average churn of a care pro annually in normal home care is 85%. And our care pros that our AI is able to kind of focus on and deliver what they want, which now is about 45%, I think. They churn at 32% annually.
Wow.
So this like massive reduction in churn, which then leads to a much better client experience. And the reason we're able to do that is that AI is very focused on what do you individually want from your job, and I'm going to try to give you those things. And so again, it's personalizing for humans, right? It's like, this care pro wants this thing, this care pro wants a different thing. And if you can actually then recognize what they want and deliver them what they want, change the game entirely.
That's so cool.
So we will use third-party tools, but there's this other thing that's going on now, as you said, which is a lot of the third-party tools, it's kind of like, why would you use it, right? You build it yourself.
Yeah, no, I saw a staffing one. It was like AI staffing for pharmacies.
Yeah.
And I was like, cool. But like, can a pharmacy, especially like a retail pharmacy with tons, like, should they just be able to build that on their own now? It's so interesting. Right. I think that we should do like some sort of sharing of like founders that have like different ways that people are using AI internally. Cause I think that these, especially in care delivery, because I think that like we can all learn from each other and get ideas from each other, because we're all just like figuring it out. And I know like that's such a cool aha like use of AI in making everything better, making it better for the customer you're serving, making it better for the employee and the care pro, and like everyone wins.
That's right. Yeah. No, it's an unbelievable win-win.
Yeah.
And I agree on the sharing. Like I benefited so much from just talking to other founders over the last, kind of 2 months, because things are changing at a rate right now that they've just not changed at in a very, like the last time I can remember this rate of change is kind of when mobile happened, like in 2012, when we were shifting from desktop to mobile.
Yeah.
That was a big change in how everybody had to think and address their jobs. But this one's even bigger, right? Because it's changing the fundamental nature of people's jobs inside companies like ours. So when you have to change the entire way you work, a lot changes.
Yeah. No, totally. Yeah. Okay. My like gears are going. I'm thinking about ways we can share more of these stories.
I'm going to rely on you for this one.
Inspire one. Yeah. I'll find time to do it.
Okay, so Halle, I have one last question for you. I always ask people, because I actually do this in every interview I ever do, I want to understand where people's energy actually comes from. Like, why do you do what you do? When you wake up in the morning, like you get energy somehow to go, and obviously you're a person who puts in a lot of energy, because you wouldn't be as successful as you are without it. Where's the motivation come from?
Oh my gosh. It's going to sound so cheesy, but like, I just want to help fix healthcare. I really wake up every day just like so excited to do the work I do. We in healthcare work with the best people. Like truly, this industry brings together the smartest, most passionate, sometimes very prickly, stubborn, but like so genuinely focused on the goal type people that I think they keep me like super excited and motivated for the future. But I can't think of another problem that is more worthy to be part of than healthcare. And I always say, like, even if what you're working on doesn't work out, like it is infinitely better to try. You can go to bed at night knowing that you tried and you gave it your all. And hopefully there are some learnings, whether a company worked out or not. Like there are lessons that you can share with others that can all go towards this very worthy goal of making healthcare massively better. And I mean, just the bar is so low that I just, it needs to happen. And I have such a privilege in my job every day, because I just get to support great founders like you and, be your cheerleader. I don't have to be like in the trenches of the stressful trenches. I get to just, be on the sidelines, being a cheerleader, giving you water when you need it. And that's like it's just such a privilege to be able to do this every day.
Yeah, that's awesome. Great, Halle. Well, thank you so much for coming on the podcast. Really appreciate it. Super interesting conversation.
Yeah.
Hope to see you in person sooner than later.
Yeah.
And Halle Tecco, thanks so much.
Awesome. Thanks for having me.